Every 17 seconds, an American is diagnosed with diabetes, and the CDC estimates that 1 in 3 Americans will develop diabetes in their lifetime if trends continue. Now, with a resurgence of COVID-19 infections and hospitalization, it has become even more imperative to improve diabetes care. On the show with us today is Whitney Morgan, who reversed her type 2 diabetes diagnosis, and Dr. Jeff Stanley, medical director and physician with Virta Health. Whitney, starting with you, when you were first diagnosed with type 2 diabetes, how did you manage it?
Well, this happened a little over 5 years ago, and I had to go to a series of doctors. I dealt with experimentation with different medications. My system is hypersensitive to side effects of many of the drugs that they ever tried with me. And so it was very frustrating because we couldn't seem to get my numbers under control without just continuing to try different drugs. Up until about 2 years ago, I finally found, I don't say I did, the doctor finally found a combination of 3 medications that finally helped to get them better under control.
And doctor, over to you now. Diabetes has long been considered a chronic progressive disease with the use of medication for treating it. Is there another way, though?
Yeah, the good news is that there is another way, and that diabetes can be reversible, with the proper support. And, what our team at Virta Health and in my job as a physician, what we're able to do is to help support patients to make lifestyle and nutrition changes through the combination of health coaching, physician supervision, and an app. And that basically allows people to make these lifestyle changes and sustain them over time. And then they're able to improve their blood glucose and eventually not even need the medications once their glucose gets in that normal range.
That sounds great. And Whitney, how has this Virta Health program helped you to manage your diabetes and kind of get you away from that medication?
Well, like I said, what took over 5 years and frustration with about 10 different medications, in about 6 months, the diagnosis has been reversed. I'm off of 2 of the 3 medications. I've lost 39 pounds, and as a result, the inflammation and the joint pain is gone. I just feel healthier, and this is self-sustaining, and it becomes such a daily routine that I don't even think about the struggle of trying to figure out how to manage it now.
That's fantastic news. And doctor, how long does it take to reverse diabetes and get a patient off the medication? And how do you know if you're maybe a good candidate for this treatment?
Yeah, I mean, the really remarkable thing is that in many cases like Whitney's, where people may have had diabetes for years or even for decades, we can still see people reverse their diabetes and bring that glucose down to a normal range in the course of weeks or months. And I generally tell people I feel like I have the best job in the world because I'm able to, be a part of a team that helps patients to do that. And then in terms of who is a good candidate, generally the way that I think about it is, folks that are sick and tired of feeling sick and tired. People with type 2 diabetes who want to make a change and to get off of that chronic and progressive treadmill of ever increasing medications and increasing A1C and weight. And so to help people kind of have hope that there is another way to address diabetes.
Fantastic. Well, thank you both so much for being part of the conversation. Dr. Jeff Stanley, medical director and physician with Virta Health, and Whitney Morgan on the show. Thank you both so much for being here.
Yeah,
thank you.